Hello, I'm Dr. Alice Fitzgerald. I work at Alliance Counseling and Coaching, and I also work at Stateville Correctional Center. And today I'm here to talk about anxiety, and specifically as it relates to the coronavirus. So let's talk a little bit about anxiety. Underlying anxiety is the emotion of fear. So people who typically have a lot of anxiety have a lot of fear. And there's a lot of things to be fearful of these days, especially given the nature of the coronavirus. It's very ambiguous, it's very unknown. So there's a lot of things that could potentially make you feel more fearful and therefore feel more anxious. Feeling fear about social isolation, about the possibility that your health could be compromised, and in general, the fear of the unknown. How long will this last? Which all affects your anxiety. So when I think about anxiety consisting of two pieces: the cognitive piece of things as well as the behavioral piece of things. When we talk about cognitively, we think about what's affecting you in your mind primarily. And so many times we try to control things that we're not familiar with or that we fear, except for the fact that there are certain things that we can control and cannot control. So I work with people and I talk with them about the fact that we have to be focused on the things that we can control. As an individual, all we can control is ourselves. So as it relates to COVID, you have to keep in mind that the only thing that you can control is wearing your mask, washing your hands frequently, making sure that you don't touch your face, keeping social distance. All of those things are important in order for you to have some kind of sense of control in light of the pandemic. All the other things that are things that you cannot control, such as what other people do, if they're going to wear a mask, who they're hanging around with, all that other stuff is stuff that we cannot control. So one of the things I tell the clients that I work with, I tell them, the only thing you can worry about are the things that you can control. Again, you can only worry about the things that you can control. So the response is usually, that's easier said than done, and yes, maybe it is, but truly that's how we need to move forward, is try to not worry about things we cannot control. So in terms of behavior, in terms of helping you get through this time, I think that there's a lot of things that we can focus on, and there's a lot of information that's written out there. First of all is finding effective coping skills. So first of all, avoiding negative things that can affect you in terms of coping. So excessively using drugs and alcohol is not an effective coping skill. So as much as you can, try to avoid using those things to excess. A lot of people find that exercise, moving around, getting out of the house, walking around in nature seems to help them with their anxiety. Another thing that's very effective is using breathing. Breathing just seems very simple, but it can be done anywhere. My recommendation is typically that you try to breathe at least 3 times a day, once in the morning, once in the afternoon, once in the evening, and use these different types of techniques, such as a 4x4 where you breathe in for 4, you hold for 4, breathe out for 4, and hold for 4, and then you repeat it 10 times. Or a 6x6, same concept, you just do it a little longer. Or you may want to do a 4x8 where you breathe in for 4 and out for 8. Combining it with a cognition of the fact that as you breathe in positive things, and you breathe out negative thoughts. So breathe in the positive and out with the negative. So try to focus on doing that at least 3 times a day. Some research indicates that it can reduce your anxiety at least 3 points in the month if you did it for an entire month. Next, I would suggest you think about considering doing visualization or meditation or even yoga. Visualization I like at night, especially if people are engaging in a lot of racing thoughts where before you go to sleep at night, you have trouble sleeping because you keep thinking about what are you going to do the next day or what happened during the day. I try to put myself in a safe but very relaxing place, such as, on the beach. That seems to be my favorite place. And so I kind of draw the picture in my mind, and then I start going through each one of my senses and be as detailed as you can. Like, what are you seeing? The puffy white clouds, the pretty blue sky, the beautiful warm water, all of that stuff. And then you go on to what you're smelling, what are you hearing, what are you tasting, and what are you touching? And that might be enough to kind of calm your mind enough so that you might be able to go to sleep. A couple other things to consider, that as our stress increases, so does our anxiety. So I want you to be aware or cognizant of the fact that there is a lot of stress that we're experiencing on a day-to-day basis. When we talk about stress, we talk about typically two types, eustress and distress. But I also want to talk about cumulative stress as well. So in terms of eustress is positive stress. It's the stuff that gets us out of bed every morning because we have to go to our job, maybe have other commitments, or we're going to meet a friend for lunch or for coffee. And so those are eustress. They're positive stress. They make us move. Distress is when we start feeling overwhelmed. And that's when we start needing to use some of our coping skills in order to decrease our stress levels. We also have to keep in mind that not only are we dealing with day-to-day stress, we're also dealing with cumulative stress, where cumulatively our stress levels can increase. So if you're going through a very busy time, such as potentially going through a divorce, having financial difficulties, the pandemic in and of itself, having children, all of those things add up over time. So if you look at your 2-year time frame and you see what you've been through in the last 2 years, and it seems like a lot, it probably is being overwhelmed. The system is being overwhelmed. So if there's things that you can avoid stressing you out by taking on new projects, I would encourage you to kind of consider not doing it at this time. So a couple of other things that I think you should consider in terms of using stress. I'm going to read a little bit here. Using self-talk. So positive self-talk versus negative self-talk is important. That means that when you do something positive during the day, or you made it through a really rough day, I want you to, commend yourself for making it through the day. All right, so try to be as upbeat about things as possible. Say, yes, I made it through the day. Today was rough, but I did it. Be prepared. Sometimes being more prepared for certain situations decreases your stress. I know that if I have to be at work extra early at times, that if by preparing the night before, I have all my things prepared, maybe my lunch already prepared, that does help me get through the morning quicker and I don't feel as stressed out. Take a new look. Look at a situation in a different way. What we're suggesting you to do is kind of reframe the situation. Instead of always looking at the negative, maybe start looking at the positive. That instead of today being a rough day or a bad day, that yes, it was tough, but I had a really good day because all these positive things happened to me. So reframe your thoughts at times. Pat yourself on the back. So when you've achieved something that you had hoped to achieve, give yourself a minute to commend yourself and saying, hey, listen, I did a really good job today. So focus on the positive. Finally, I want to just talk about quickly coping with coronavirus. These come from psychcentral.com. Consider keeping the risk in perspective, such as, I think sometimes it's easy for us to panic about a particular situation. Like we talked about before and earlier, if we utilize our personal control, where we take in and do the things that we can do, we don't need to kind of focus on the negative and be overwhelmed by the risk of the coronavirus. Take a normal and healthy precautions. Again, healthy choices. Make healthy choices. get out of the house, walk around, do positive things. Don't engage in any kind of excessive alcohol or drug use. Avoid consumption of media. So we can easily be overwhelmed by the news reports on a daily basis, or even take on listening to other news stations even in the evening instead of focusing on watching other programs. Take small doses of those versus constantly being updated in terms of the most recent information about the COVID issues. Finally, use your past scoping skills. So if there's anything in particular that you use that seems to be pretty effective in terms of coping through this tough time, please continue to do that. I know that when I have a lot of anxiety, I find that taking a nice long shower helps me relax, especially when I go to bed. It also helps me kind of allow all the negative things of the day to kind of be washed away. So think about doing that. I hope that this was helpful for you, and I am there if you want to reach out. Take care and have a great day.